Gluten-free and why it's a big deal. You probably heard the term gluten-free before and have wondered what it meant. Why are all these restaurants offering gluten-free options? Why are people eating gluten-free? Well, first you have to ask, what is gluten? Gluten is a protein found in wheat, barley, and rye, which is what makes up everyone's favorites foods and drinks, such as bread, pasta, and most alcohol. I bet you're wondering now, why would someone subject themselves to a life without bread or pasta? Well, a gluten-free diet isn't designed for everyone. It's for people who are diagnosed with celiac disease. Roughly 1 in 100, or about 1% of people have celiac disease, an inherited autoimmune disease that causes damage to the small intestines when gluten is ingested. When people with celiac disease eat gluten, their body mounts an immune response that attacks the small intestine. These attacks lead to damage on the villi, small finger-like projections that line the small intestines, that promote nutrient absorption. When the villi gets damaged, nutrients cannot be absorbed properly into the body. The only treatment currently for celiac disease is a strict gluten-free diet. Celiac disease can develop at any age after people start eating foods or medicines that contain gluten. Left untreated, celiac disease can lead to additional serious health problems such as lymphoma, thyroid disease, and fibromyalgia. There are more than 200 symptoms associated with celiac disease, which makes diagnosis difficult. A significant percentage of people with celiac disease, both adults and children, have no or minimal symptoms. Here are a few. In adults, there's unexplained iron deficiency anemia, fatigue, bone or joint pain, arthritis, depression or anxiety, peripheral neuropathy, the tingling, numbness, or pain in the hands and feet, seizures or migraines, missed menstrual periods, infertility or reoccurring miscarriage, canker sores inside the mouth, and an itchy skin rash. In children, there's abdominal bloating and pain, chronic diarrhea, vomiting, constipation, pale, foul-smelling or fatty stool, weight loss, fatigue, irritability, behavioral issues, dental and enamel defects of the permanent teeth, delayed growth and puberty, and attention deficit hyperactive disorder, otherwise known as ADHD. A simple blood test is available to screen for celiac disease. People with the disease who eat gluten have a higher than normal levels of certain antibodies in their blood. These antibodies are produced by the immune system because it views gluten as a threat. You must be on a gluten-containing diet for the blood test to be accurate. And the only way to confirm a celiac disease diagnosis is by undergoing an endoscopy biopsy of the small intestine. The symptoms a person with celiac disease may experience after being glutened can vary, but the average person, it goes something like this. Almost immediately after the gluten is consumed, the reaction begins, often as a feeling of becoming flushed with a drop in blood pressure. Shortly afterwards, symptoms of reflux may occur by intense fatigue and stomach pains, gas and bloating, which persists for the remainder of the day. At night, insomnia is not uncommon, and the following day is often marked by gut pain and cramping and frequent bowel movements. Moodiness, irritability, and anxiety are common, and many people experience problems thinking, which they describe as brain fog. Itchy rashes and joint pain are not uncommon. For most people, the symptoms persist for 2 to 3 days before finally clearing up, a hefty price to pay for consuming a minuscule bit of gluten.